Hello everyone, it's Physician Assistant PA Patel here. So most of you guys are aware of the importance of vitamin D, but do you know why it's important? That's what I wanted to touch on today. Vitamin D is readily used by our immune system. There are actually receptor sites for vitamin D on our immune cells, and different cells like B cells, T cells, antigen presenting cells, which are different pathogen fighting cells in our body. They require vitamin D to function properly. So this winter, when naturally rates of respiratory illness are higher, we want to make sure we have optimal vitamin D levels to prevent and fight off infection. So where do we get vitamin D from? In our diet, we can get vitamin D from fatty fish, things like wild-caught salmon, sardines, trout, and we can also get vitamin D from mushrooms. So you can definitely make sure to incorporate those types of foods in your diet. The other way we can get vitamin D is from the sun. So when we are outside, UVB rays from the sunlight hits our skin and converts cholesterol into an inactive form of vitamin D. That inactive form gets activated through several hydroxylation steps that happen in our liver and in our kidneys. So there is a downside to this because we are not spending a lot of time outdoors, and most of us midday are actually indoors, so we are not getting enough vitamin D from the sun. And then if you think about other places in the country or in the world, during the winter time there's just less sun naturally as it is as well. So most of us are actually in a deficient state when it comes to vitamin D. The other reason for that is because we're using it up more as well. So there's many different stressors on our day-to-day, different pollutants and toxins in our environment that are activating our immune system and using up that vitamin D. Even though we're not feeling effects of those stressors in the forefront, our body is using up vitamin D there. So we're not getting enough from the diet and from our sun, and then we're using it up more. So that puts most of us in a deficient state. That brings me to why most of my patients are on supplementation. I can actually go as far as saying 100% of my patients are on a vitamin D supplement. So this winter, if you are not on a vitamin D supplement, I would encourage you to start one. Talk to your doctor, get your levels checked, and bring up those levels. For those of you that are TLC patients and are on a maintenance dose of vitamin D, if you are starting to have any sniffles, congestion, sore throat, cough, runny nose this winter, definitely double, triple up on your vitamin D supplement for about a week or so, and then give us a call so we can assess your symptoms. But by boosting your vitamin D, that will help boost your immune system and help you fight the infection. So I hope this helps, and stay well, everybody.